Okay. So from here, I'm not sure if this is recording or not. It might be, or I might have to delete it later. But
It is,
um,
it's
so
recording.
what is your heel pain stopping you from doing?
Um, it stops from doing long walks, like walking the dog. Um, that's the biggest thing. I mean, it's some days impacting pretty big quality of life
Yeah.
uh, stuff. So I don't know, but I suspect it's plantar fasciitis. But
Talk about that. Imagine that.
trying to get some education.
Well, we have the education for sure. So, well, there we go. Well, the first thing we look at is, and this is this may seem like a silly question when we say, what is heel pain? It's pain in your heel. But it can be in different parts. And it might be on the bottom of your heel, like that place where right underneath the center of your heel when you're standing. It might be more on the back of the heel or the inside. Those are the most common places that we see it. Sometimes people have heel pain because they did something like jumped off of a ledge and landed hard on onto like concrete, and they have like a bone bruise or something like that. Sometimes heel pain feels a little different than that. Some people have the pain, but it may also have some numbness or tingling in anywhere in the foot accompanying with it, which is really important when you're looking at heel pain to look at what is this pain. Because if it's numbness or tingling, sometimes it's more than just a heel problem. There might be a nerve involved. There might be blood flow issues. There's a lot of things that go hand in hand for that heel. So when we look at someone who comes into the office with heel pain, we very rarely just, and I see this happen when people go into doctor's offices a lot, they'll say, my heel hurts. And so what do? They look exactly at the heel, and that's what
Yep.
they look at. And in reality, there's a lot that goes hand in hand in how that heel and the things that go on at the heel, because the heel is not just a heel. It's attached to your foot and your ankle and your foot and the entire leg. So it's sort of at the mercy of everything else working well as well. So we do have to look at your toes. If you have those toes that do this, I don't know if you've ever seen like old lady toes for someone who wore high heel shoes for years and years. But if your toes are kind of pointing inwards, like a little point, like a lot of shoes will make us do, that can affect a lot of things in how your foot works.
Okay.
What?
I was looking at my toes.
Oh, that's good. That's really good. So the toes are a big part, because if your toes aren't able to, if you look at people in countries where they don't wear shoes or they wear flip-flops their whole lives, and you see these professional runners from Kenya, if you look at their feet look like this. All right. They're not pushed in like American feet are, because we shove our feet into little shoes as soon as we're babies, and we don't walk around barefoot that much. But people who run flat, like barefooted, and they're barefoot their whole lives, their feet are kind of flat and their toes are kind of spaced apart. So it's interesting how different ways that your toes function control how the rest of your foot leaves the ground as you're walking. Now we've got from the toes, we work our way up. You've got the foot, which can include the arch. It can include the bones that are right across the top of your foot where your shoelaces tie. Those little bones, some bones are supposed to move and some bones are not. So if the wrong things are moving or the right things are not moving, then that can create problems that translates to the heel as well. Now, most people think of the ankle as that part of the foot that sits in the back of the cup of your shoe. When you go right above there, you're looking at your ankle. That's the actual joint where when you look at it, here's my friendly little foot. So the ankle joint is right here. So that's the part where your foot can go up and down at. It's kind of that hinging joint that's happening at the bottom of your leg. Now, a lot of times people will think, well, here on my little foot, he's such a happy little foot, right? Right here, this is called the calcaneus. It's what most people think of as the heel. And most of the time when people tell me they have a heel problem, they expect that this is where the problem is. Well, we have to look all the way up into the shin, the knee, the hip, and all the way up the whole chain. And I don't know if you remember that little song, knee bone's connected to the thigh bone. Well, we have to look at how all of that works together. Because if the hip is funky, and it's turned the whole leg out, then your foot's going to land kind of sideways, or it's going to collapse in where the arch of your foot's going to like flatten out in ways that we'd rather it not sometimes. And we have to look all the way from that big toe all the way up the chain, all the way up. I tell people, if we're treating the foot, you have to examine someone all the way up at least to the bra strap, or the ribs if you're a guy, because most guys aren't wearing bra straps nowadays. But you have to look at how that whole system works together, because if one thing's funky, then the whole rest of the chain is going to be funky.
Yep.
All right. Is all of that making sense so far?
I'm with you.
All right. So what we look at is there's 3 typical causes of heel pain. It can be from an actual heel problem. Maybe you changed running shoes, or maybe you started running on concrete when you're used to running on dirt, or maybe you switched jobs where you're standing a lot now. Maybe something happened in the way that you're using feet that now you're putting extra stress on something called the plantar fascia. And the plantar fascia, if we get out our trusty little foot again. So I know it's a little harder to see, but this is the big toe, all right? So if we turn this foot sideways, right here where my finger's pushing, do you see how that makes a little bit of an arch?
Mm-hmm.
All right, well, when that arch, you have something called the plantar fascia that goes from the heel, and it comes under the arch all the way out to the ball of your foot, right under the big toe. Right, that whole ball of your foot, it makes a really tough fibrous attachment that helps give some stability to your foot as you're walking. Well, that plantar fascia, where it attaches right here, I don't know if you can see that little bump under the heel, where it attaches there, when you sleep, if your foot's like all curled up like this, or your toes are pointed down because the blanket's pushing them down, well, then what happens is when you're sleeping, it heals up in a nice tight position. And then when you stand up and put your foot on the ground, it's almost like you rip up all that new healing, and you feel like this really sharp pain right on the bottom. So where that attaches, that's called your plantar fascia. Now, we're going to hang out and let's see. I've not actually done this part before. We're going to get in the floor and talk about feet for a second.
No, baby. No, come up here.
Does Riley want to learn about plantar fasciitis?
I think Riley wants to go OUT or a snack. Oh, wait, I shouldn't have said that word, but yes.
Okay, can you see my foot?
I can.
All right, so right here, this is the arch. So you might have like a high arch or a flat foot. Different people have different arches there. And just because you have one or the other doesn't mean it's wrong, but you have to look, are you accommodating that arch appropriately? But if you look right at the back of this arch, so it kind of comes up and back down, right at the back of that arch. So if we look at the bottom of the foot, woohoo, bottom of the foot.
Oh, that's good.
All right, right on the inside part of that heel, if you push right there, so it's kind of like you follow the arch, and right where the arch kind of comes right back down to the heel, that spot on the inside of your heel, you can almost push right there. And if it's just plantar fasciitis, you should definitely have a lot of tenderness right there. Now, if it's not that tender, then that's okay. That just means you have more than just the plantar fasciitis issue going on. Oh, what tender?
Sorry. So depending on where, that's the spot that is usually painful.
Okay, and I'm going to show you.
I just have to find it, and I don't always have it, but yeah.
So that is the main place. Like the plantar fascia actually attaches all through right here, but it mostly you'll feel it right in that inner spot on the front of your heel. That's where you'll feel it if it's more plantar fasciitis. Now, if we go back to looking at the foot, right back here, I don't know if you can see where I'm pointing to the back. That's where my Achilles tendon is. All right. If it's tender back here, when I push straight on it, then I might have a component of the Achilles tendon. Now, a lot of people, if they have pain on this inside part of the arch, back here on the Achilles, on the inside of the Achilles, that might be tender too, all the way down onto that bone of the heel. I don't know if you can see where I'm pushing. So straight in the back, that's where the Achilles is. All right, if I come slightly to the side of that Achilles and work my way down, I might get some tenderness anywhere along here as well.
It feels tight, but it doesn't really hurt.
Then that's good that it doesn't hurt. Now, the last thing that we look at is if you look at my leg, there is a little nerve that runs right down behind the knee, and it actually splits into a couple parts. So I'm going to show you my other leg. On the outside of the knee, you have one nerve that's going to, where it splits, it's going to come down this outside of the foot. The other one is going to split and come down the back, and it wraps around this inside of the heel. And guess where that nerve happens to go around? The same place where we're putting on that plantar fascia, on the plantar fascia. And that plantar fascia attaches here, and it goes all the way out to the ball of the foot. Does that make sense so far?
Yeah, that little nerve had to be in the same spot.
I know. It would be so nice if it was just like kind of pick one thing and that's what it did. But now here's the tricky part when we look at heel pain. Oop, there we go. So when we're looking at heel pain, we have to look at what's going on. And I promise you that your feet did not just wake up one day and say, let's be mean to Jennifer. All right.
No, I think I know what happened, but.
Well, and there's usually what happens is there is some kind of force. Either you're putting forces through your foot in a different way than you're used to, or you change and start putting more forces through your feet than you're used to, or you do both. You put more force, you start using your feet more, and you're putting it in a funky, you start doing something different. And when I see this when people take up a new sport or activity, or it's interesting, we actually see this a lot in people when they switch to a desk job, when they've been used to standing and moving around a lot, and then they stop and they're kind of resting a lot, and then they jump up and expect they can keep on going the same amount, but those tissues aren't used to it. So for these, for most of these foot issues, something has to change. Now, where it gets interesting is when people can't say, oh, it changed when I did this thing. Some people can, some people that's not the case. So when it happens that you're not sure what the case is, we have to examine everything from the toes all the way up the back and see what's going on. Because we talked about the plantar fascia and we talked about the Achilles tendon. And yes, there's that one nerve that happens to go in the same spot where you feel that on your inner heel. But that little nerve, if you trace it all the way back up, it goes all the way up the back of your leg. Oops. I think I have a notification. Okay, I'm learning to do this by myself. Usually when I have these workshops, I have someone here helping me. Oh, just kidding. That's not from Zoom. Sorry about that. Okay,
It's
so
just me.
If we track that nerve and follow it all the way up, it goes up the back of your calf, behind the knee, and up the back of your thigh, through your bum, up into the back, and joints with the spinal cord. So if you have anything going on in that lower back, where maybe the blocks of the spine have a little motion that's not well controlled, or there's a little disc bulging out into the nerve, or maybe we're not 20 anymore and we start to get the flattening, aging of the discs and the joints, and we have a little wear and tear that can be aggravating. If anything on that whole path of the nerve, that nerve gets aggravated anywhere, it's more likely to get aggravated everywhere. Does that make sense?
Yeah.
Have you ever heard of a pinched nerve before?
Oh, yeah.
So like that pinched nerve, sometimes if you pinch a nerve, you know how if you hit your elbow, you can feel it all the way down your fingers? Same thing happens in your back. If you're aggravating a nerve a lot, you'll feel pain in the back, down into the bum sometimes, and maybe even down into the leg. Well, if you irritate it just a little bit, you may not even feel a lot of pain from the back, but that nerve the whole way down then gets irritated, and the slightest thing can set it off. And that same interface that we talked about where the, come on, where's my foot? I know I had a foot here somewhere. So that same place that little bump that we talked about where the plantar fascia attaches, that nerve comes right under where my finger is, and the plantar fascia comes right here. And there's also a little ligament that comes right here. So there's several different places where that nerve, if it's rubbing, because maybe things aren't working the way they're supposed to, it can get really irritated. And well, nerves, they don't like to be irritated. They can give you a whole lot of pain if that happens. So when someone comes in with heel pain, and I see this all the time. If you're on Facebook, if you type in heel pain in your search engine at any point, you'll get like 100 of these things. And it'll say, oh, you need this special shoe or this special insert. This is the one thing that fixes heel pain. Well, it might fix one person's heel pain for their particular problem, but you have to look at each individual person and how many of these factors are at play, because if one problem is because you're compensating for another and then you add a insert in there, it can make the other problems that much more worse. So you have to look at how all of those work together. Does that make sense so far?
Yeah.
Those are the main causes. There's other causes too, but so there's Murphy. There's my dog, Murphy. Hi, I'm Alaina Marino. I'm your guide by the side as we go through this fixing the heel process. Those are my credentials. I might have done a bit in the educational side of things to get to where I am. The biggest thing here at the very bottom, that was a fellowship in orthopedic manual therapy, which meant I got to work with some really smart people that made me do a whole lot of work and studying and research to be able to get to do things I do now. Mostly people ask me what I do. I tell them I'm a body mechanic. Now, you can't just drop off your foot and I fix it and you pick it up next Tuesday. Not that kind of body mechanic. But
wouldn't that be nice?
so yes. So if you're wondering who the heck is this woman and why is she telling me stuff about feet, it's because I study bodies, because I'm a nerd. And that little dog, Murphy, I'm not sure why he's sticking his tongue out there, but he is. It gives him a little personality, I think. So with all of this background, people ask, like, how did you end up specializing in treating some of these really complicated conditions? And the reason is they can be really complicated. So there are some things that happen that we know, here's how you treat it. You just do X, Y, Z, and voila, it's fixed. You have a broken bone, guess what? We put you in a cast. You stay in that cast for a certain amount of time until the bone heals, and then we get you out of it. Like, there's certain ways that you treat certain things. Well, heel pain is one of those that does not have a universal, this is how you fix it. So when someone doesn't do well with kind of the standard treatments that are out there, that's when they come to hang out with me, because I have some other training to be able to look at and see what else is going on. Why isn't this just resolving on its own? And we have a lot of people who they do the basic rest, ice, compression, elevation for a couple of days and they do just fine. Unfortunately, with heel pain, it's not like you can just say, okay, heel, take a vacation. Because every time you take a step, it's going to try to, your weight's going through your whole leg. You can't just ignore the heel unless you're on crutches or something like that. So I keep waiting for Riley to like pop her head up again. Excuse me. There she is. Yeah. Okay.
There you go.
So we talked a little bit about what bothers your heel and about how it's stopping you from being able to do the things you're wanting to do. Excuse me. So a lot of people ask me, is there anything I can do about my heel pain? And I usually only have to ask them one question in order to know the answer. And that's, is your pain reproducible? Is there, if I do this one thing, then it brings my pain on? If your heel pain is there and it's no different whether you're awake or asleep or whether you're walking or resting, if it's exactly the same and nothing changes it at all, that's a different kind of problem. And I'll tell you where you need to go if that's the case. But for most people, they feel that pain either if they've been sitting for a while and they go to stand up. Sorry, I'm getting ahead of myself. So you got to ask yourself, in the last 30 days, what's the worst pain that you've had with your heel? And then you want to think about, like, what were the activities you were doing when that actually happened? Were you standing up and putting weight through the leg? Were you sitting for a while and then tried to stand up? Were you walking too much? Were you putting pressure on your heels? Were you walking on your toes? By the way, high heel shoes, not a great plan for this, in case you were thinking about it. Or was it your first step when you got out of bed in the morning? So if you have something specific where your pain is reproducible, I usually have this really cool little thing. I don't know where I put it. But the words reproducible, the pro kind of disappears and it says reducible, because if your pain is reproducible, it's reducible. So that's kind of the cool thing, where you're not just doomed to a life of pain there. So if your pain is reproducible, then it should be reducible, and there are things you can do about it.
Ooh.
I know, the single biggest mistake. So when people ask me, so what can I do about my heel pain? Well, there are a few things you can do. Let's talk about the worst thing you can do. The biggest mistake that people make when it comes, I know all the tension, what could it be? The biggest mistake that people make when it comes to taking care of their heel pain is they ignore it. This usually comes in the form of an excuse, like, oh, it's not that bad, or it'll get better on its own, or I can handle the pain, or I don't have time to handle it right now. I'm too busy doing other things. This is where we see a lot of people get into trouble, because they let something that kind of is annoying, they let it just keep getting worse, until people don't really do anything about it until it really hurts and stops them. And then like, oh, now I have a problem. And then they go and get it looked at. So again, 3 things you can do. First thing you can do is ignore it. I love the little monkey on it. I have way too much fun picking out little figures for these presentations. So you can ignore it. We talked about that. You can alter it. This usually comes in the form of addictive medications, painful injections, or really expensive, painful, and often ineffective surgeries. And a lot of times people will say, well, my foot hurts, I just need to get surgery. I will tell you that foot surgeries are probably one of the worst ones I see, because yeah, there's some things you can do to try to put a foot back together again. But if you don't address those mechanical faults and factors that cause the problem to begin with, then guess what? Have you ever heard the definition of insanity? You keep doing the same thing, you're going to get the exact same result. So even if you have a beautifully fixed foot, if you don't fix the reason that the problem came on to begin with, you're going to create more problems. And especially if they do one of those surgeries where they remove bone or they fuse something, or then that tissue that they just fixed, not only is it going to take a lot of undue stress, but your other tissues will then have to make up the difference as well. And finally, the third option is you can actually handle it. You can do something about it, right? And people ask me, well, what does this look like? So this usually looks like, guess what? I'm a physical therapist. I'm going to tell you, it looks like physical therapy. So people ask me like, hey, and usually these are people who've already had, have you ever heard, do you know anyone who's ever had a steroid injection before? If they do a steroid injection like into a joint or into your heel or into your foot, that needle, it's a big needle, and these are really painful to go through. So, and sometimes you can, with the steroid, what it does is it takes the inflammation and it stops it in its tracks, which can be a good thing. But again, if you don't address the reason it came on to begin with, it's just going to happen again. And then it's just a short term, a little bit of fix, but not really fixing anything. So when it comes down to what physical therapy looks like, the most important thing that you get in physical therapy, besides pain relief, the most important part is the assessment. Is to be really precise on exactly where that problem is coming from. You remember at the beginning when we were going over, like, here are all the different things that can go on that will affect your heel. So you can't just say you have heel pain. You have to be really clear about what tissues are involved, how they're involved, why they're involved, and really get to the root cause of the problem. If you don't get to the root cause of the problem, it's like being in a sinking boat and just bailing water out and never plugging the hole. I mean, you might just be really excited to do physical therapy forever and not get anywhere. But if you don't, if you're not addressing the right thing, you're not going to get better. Next, hands-on physical therapy. I will tell you, I love doing this presentation with a big group of people because I have everyone stand up and then I watch everyone squat down and stand up and then go up on their heels and stand up or go up on their toes and then sit back down. And then we go through like, okay, who had a problem with that? And we get them up on a little demonstration table. And I'll tell you, probably about 80% of the time, there's 2 techniques I do. One for the ankle and one for the big toe. We don't even touch the heel. And we do one little stretch on the hip. And then we have them stand up and try it again. And they get up and their pain is down significantly. It was so funny. The last one of these we had, Danny was actually the one who was doing that one. And his demonstration woman, she was just like this. She's like, I'm a nurse. What are you going to do to me? And Danny worked on her for like 3 minutes. It took him about 3 minutes. He looked at her, okay, this thing on the ankle, this thing on the toe, and this thing on the hip. And she got up and then she squatted up and down. She goes, that didn't hurt so much. And she goes, I don't know what I think about this. And she went and sat back down. And it was like, okay, well, and he kept talking. And then she stood up in the middle of his presentation. She goes, wait a minute. And he was like, uh-oh, what's going on? Like, most people don't just stand up in the middle of your presentation and start talking. And the woman, she goes, what did you do to me? I don't have any pain right now. I haven't had no pain in like 2 months. What did you do to me? And he was like, well, he explained what he did. And she was like, I'm going to come see you tomorrow. And she was like his best patient until she fell down. She tripped in her yard and broke her foot doing something else entirely. But anyways, so it's interesting to see how, if you're really precise on where the problems are, you can get better pretty quickly, but you just have to have that precision and someone to be able to get in and be able to check the joint and see, is this the direction that's not moving? And not everyone's the same here. So if you try to, a lot of times people will get those stretches and they'll say, oh, you need to stretch out your calf muscles. I'm going to go ahead and tell you right now, it's not going to do anything for you. Yes, you can do some stretches first thing in the morning with a little belt to stretch out your heel cords. That can help you with that first step in the morning.
Okay.
Ultimately, if you're not addressing where the weaknesses are, what's going on, that tightness, it's your calf muscles. I promise you, they did not wake up this morning and say, let's be mean to Jennifer. What they're doing is they're just trying to hold on to get a job done. And if they're not able to do it well, they just get tight and hold on the best they can. So while there may be some stretching to that, it's usually, we might have a little bit of stretching and strengthening in the hips so that the foot can hit the ground in a nice way instead of in a wonky sideways way. Yeah. And that takes care of most of it. And I'll tell you, most of the things we do with people for their heel pain is more at the hips and the low back, which seems like, that's not my foot. What are you working on my bum for? Like, yeah. It seems a little odd, but you have to look at how they all work together. Now, once you get things, if you use the hands-on stuff to turn the pain off, I found it's much easier for people to follow through on 2 or 3 things they have to do at home to stay better. It's a lot easier for someone to fix you and you stay better than it is for you to try to push through pain to fix yourself. Does that make sense?
That's what I love about you. Yes.
Well, I don't have too many people who are like, hey, Alaina, I'm in pain. I want to do exercise. Yeah. No, it hurts. You don't want to do that. So that's where you have to look at, yes, we do need to do a couple of key things to stabilize and strengthen and retrain how your body is using your back, hip, knee, ankle, foot, toes, heel. But that doesn't mean you need to spend all day walking around thinking, okay, I need to walk this way, or I need to, no one has time for that. You're thinking about, oh, where's my dog about to poo? Or you're thinking about the things you're doing. Like, what did I walk into the kitchen for? So you've got to have those things working in a way that is the way they're supposed to work so that it just becomes natural for how you're moving. Now, that is tough. I'll tell you, heels are one of the toughest things to treat because people don't stop walking. And People let this go for a long time before they finally start getting it treated. So
Yes.
those couple of bits make it a little tougher, but if you have people follow the directions, and it's one of those things that you probably only need the actual physical therapy for like maybe about 2 weeks or so to get you on the right track. And it's like, all right, here comes the boring part. You just have to do the work over and over and over again. And it's going to take, that's easily a 6 to 8 week process of you having to work on that. So most of my heal patients, we work with them for 2 to 3 weeks, and then we just see them like every other week to make sure that they're kind of staying on track.
Doing homework.
Exactly. And I'll tell you, I'm going to tell you exactly what happens is I'll have someone that's like, oh, I'm starting to feel good. I'm like, that's great. Don't blow it.
Don't stop.
Because what'll happen is they'll say, oh, it hasn't hurt in like 2 weeks. And they're like, oh, it doesn't hurt. I'm not going to do that stretch. And then they get up that next morning and they're thinking, I feel good. I'm not worrying about the stretch. I need to make it to the bathroom. And they step. And as soon as they do, they flatten that arch, it rips, and they start the whole healing process all over again. So the healing process is closer to that 16 to 18 weeks. That doesn't mean it takes that long for you to feel better or get back to doing what you want to do, but that does mean that you're looking at 3 months of actually it's closer to 4 to 6 months of sticking with it. Here's what I need to do. Now, if you're really precise in what you're doing, it'll probably take you about 3 minutes a day to treat it, but you have to do it, because if you don't and you back off on that, then you really don't want to get you don't want to just get pain relief. You want to get problem relief. And if you think like, here's normal, and then you have damage, 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 pain and damage, pain and damage. People think that because they're out of pain that they're out of problem. And in reality, you need to get out of damage too. So there's some cool things and there's some cool things you can do to turn the pain off. But is the problem off? No. And that's where that's where so many people struggle. And they're like, oh, you know what? It doesn't hurt anymore. It's fine. And then people will have this come and go. Like, oh, I had heel pain for like 3 days and then it went away. And then it came back again like 2 months later, but then it went away again. So I just ignored it. These are those things that they'll kind of just keep sneaking up on you, getting a little worse, a little worse, a little worse. And the more you let that go, the more it becomes a problem. Let's see, static ultrasound. We're not looking for babies in your feet. We do use ultrasound. If you use it on a certain setting, it'll actually, it's almost like, I think of that little guy at the airport with the little flashlight saying, hey, over here. It basically changes the polarity in the tissues to attract the little, I think of them, the concrete trucks that say, hey, pour that concrete here. Let's heal up right in this exact spot. So that is something kind of cool that's come out. They used to use ultrasound to heat things up. We know it doesn't work that way anymore. So if you go to someone and they're like, yeah, we're going to do some ultrasound to heat up the tissues. I mean, you can put a heating pad on it at home. That's not what's actually happening with that. So
is that similar to a laser?
So laser is actually really cool. I'm thinking about getting a laser for our clinic. And then this whole COVID situation happened and we have to close for a month. I don't know if we can afford a laser just yet. Maybe that's in our 3-year plan now. There are some cool things with laser coming out. It is not typically covered by insurance, but there are a couple that, how do I put this? There's one that looks like a ball that kind of, it's a glass ball. I started to say crystal ball. That sounds a little wooky.
Like a microphone.
That what? Yes.
It's a microphone.
Exactly. And you kind of roll it over. I like that particular laser. I think it does a pretty good job. It helps with healing. It's kind of like a lot of other things. It can really help speed up the process. But how do I put this? If you go to the emergency room with a knife in your arm, all right?
You don't want the laser.
Oh, well, I mean, if you go to the emergency room with a knife in your arm and they take the knife out and they stitch you up and say, okay, go home, take care of yourself. All right, you had a problem. Now it's on its way to being fixed. If you go back the next day and you have another knife in your arm, the doctor's probably going to look at you and be like, hey, if you keep putting a knife in your arm, you're never going to get better. So while there's some cool things we can do to help the healing process, if you keep doing the bad things that keep hurting your foot, you're never really going to heal up, are you?
Yeah.
Does that make sense? But if you do the laser in conjunction with unloading the tissues, the mechanics, then I think it's a great adjunct to it. It's just not something, and a lot of people get pain relief from that. That's wonderful. But if you're not doing the other things together with it appropriately, then it doesn't really make a whole lot of difference either way. So that's why I have some people who are like, I love the laser. It did so many great things. And yeah, because they were doing it in conjunction with stopping hurting themselves. But then I have some people who do like just the laser, and I have some people who are like, oh, it felt nice, but did it really help? I don't know. Kind of, does that make sense? Oh, what did I do? Oh, I did something.
Somebody else joined, but now they're gone.
Oh, that was Sam. She was probably checking in on us. She works with me.
Gotcha.
Unless it's a different Sam. I didn't see anyone else named Sam that signed up. So let's see. All right, we talked about thorough assessment, hands-on work, stabilizing, strengthening, and static ultrasound. Did those things make sense so far?
Yep.
And sometimes we look at things like shoe inserts and arch support and taping. It's a little bit different for everybody who needs what, but those are the common things that we tend to see people need for heel pain. This is the part where we'd have a patient demonstration, but we don't have any patients here right now. So of course, I think if anyone needs PT, you should come see us. Now, that being said, if you're not anywhere near us, like we had someone from Louisiana sign up, make sure that when you do go to somebody that they're saying a lot of the things that we're talking about, and you should leave that first visit feeling like, okay, they were very targeted with exact their pain. They were able to turn my pain on and off. They were really specific on what the problems were that were contributing to my problem. If you just overdo it one day on a hike, guess what? In a few days, it should settle down just fine on its own. But if it's not settling right down, then that means that some of those other factors are at play and they need to get looked at. So this is where people are like, well, how long can I let this go before I have to do something about it? Yeah. Well, you can keep going until you can't walk. That's not a smart move in general, because you'll need to walk to get out of your house and into the office. But usually people ask like, okay, when do I need to do this? It's like, well, when you're ready to actually get some answers about what's going on, you need to get seen. When you're ready to stop the pain,
yes,
you need to get seen. When you want to get back in action in a very efficient way, and you don't want to get one of those handouts that has like 30 exercises on it, and they say, do this 3 times a day, da, da, da. If you're ever get to visit our office, if you're back through town again, you see one of our brochures that says pain-free in 4 minutes a day or less, that's because we're strong believers in that if the therapist is good and on target with exactly what the problem is, then you treat just those things that are the problem. You don't give every single exercise you can possibly use for the foot. And in reality, I'll tell you, most of my ankle and heel pain patients only do like 2 things for the foot. Most of it's for like the hip and the back and the nerves. But if you're really precise, it doesn't take that much each day to do what you need to do. And of course, when you need or want the best. We're the most credentialed therapists. We have another therapist that's joining us. He's going to add an extra 30 years of experience, board certified specialty fellow. Like in the grand scheme of certifications of people who've gone on to do the hard learning to really get good at these things, our clinic just happens to have the most credentialed people in East Tennessee. So not to brag, that's just the numbers. I haven't found any other clinic that has that many in one place. Usually what happens in a lot of practices is they get one good person. They're like, this is great. Then they get 2 and they say, oh, wait, we have 2 people. Let's split them up and put one in this practice and one in that practice. And then if that person decides to, I don't know, retire or move out of state, then they have a whole practice that they just put anyone in at. So we're going to do things a little differently. We're going to keep all the experts in one center of excellence so that we don't ever have to worry about diluting quality or anything like that. Which is why I opened a practice. It's kind of exciting.
For you.
So now you've got to ask yourself, what are you going to do next? Are you going to ignore it?
No.
Are you going to alter it with addictive medications? Yay.
Oh, goodness, no.
Like,
no med.
If you want to just stick with those and not actually fix the problem, or surgeries or injections, that's the alter it method. Or, ta-da, you can handle it. I have way too much fun with these PowerPoint presentations.
They're good.
What that usually looks like, if it's something that you're wanting to handle it with, we are in the middle of a crisis right now, and we don't encourage people to go and hang out in clinics where lots of people are running around. What we are doing with our patients right now is we just do one-on-one Zoom sessions, kind of like we're doing right now, where we actually just have whoever we're talking with put their phone up in a way that we can, or their video, so we can watch them walk and we can watch them move and assess a lot of these things.
Gotcha.
Of course, it's not quite as good as getting your hands on and feeling the tissues, but kind of like I was talking you through, okay, push on this spot. Does that hurt? We can get most of that information with that consultation. And if it's something that we really just need to get in and actually move this joint in this way before anything's going to change. I actually just did one of those about half an hour before this visit where I had someone come in. This sounds bad. We're pulling his leg. Now, we actually just got that one little joint moving. And then, okay, here's what you need to work on. The rest of the visit was like 10 feet away. So those are things that we can do. And we do offer discovery calls, which is where we're talking about, like kind of like you and I are doing now, talking about like, hey, what are the things you have going on? What would handling it look like? Or is it something that maybe you're not ready to handle it? You have a nail at the bottom of your foot that someone needs to take out and then give you a tetanus shot. Like,
forget about that.
There's a commercial of this couple having a conversation, and she has a nail sticking out of her forehead. And she's like, I just have this pounding pain right here. And he's like, you have a nail in your forehead. She's like, you're not listening to me. I'm trying to tell you. He's like, no, you have a nail. Anyways, every now and then someone will come in and it's something like, oh, you had a splinter and it became infected. And no, this is not where you need to be. But for the most part, people can figure that out before they get to us. But anyways, so those are some of the things that we offer. If you're ever interested in joining us for another session, there'll probably be webinars for the next month or so, just for general public safety. We do ones, our upcoming ones are on shoulder pain and the rotator cuff. We're doing one on knee pain in May, and then we have a posture one next Tuesday, I think. That might have been, sorry, I can't see our little calendar from here. I don't know if we have a posture one yet. We usually offer a posture one every month too. So
I saw your posture on the news.
Oh, did
when you got interviewed? Yeah.
Yes, that's, oh my goodness. Those people are so much fun. They, you get to go in and you just talk and and it goes by so fast. And every time they have to be like, Alaina, stop.
Yeah, you only have a limited.
Exactly. We only have like 90 seconds. So, but yeah, that's my information about heel pain. Do you have any questions?
I don't think so.
Did most of that make sense as we were going through?
Oh, yeah.
I kind of flew through it.
I had somehow forgotten about the hip and back components. I know it caused mine, but it's a little bit precarious because I fell down the stairs a few weeks ago. So
Oh.
it sounded like, yeah, and I wouldn't go anywhere because I'm terrified. So I walk. So I was like, I'm not calling the ambulance if I can walk. But,
yeah.
So now my walking is even more uneven. Compensating for the hurt leg, and the one that has the heel pain is now like, oh, but there's 20 legs too. So it's like, dang it.
Yeah. You don't have a good leg to stand on.
Yeah. That was awesome. That was awesome, Alaina. That was good.
It's
So, yeah.
hard. It's hard when that happens. And then you get compounding factors, and it can really wear on you too.
It happened before that. It had impacted walking and tennis. I don't play a full game of tennis, but I'm in tennis clinics or was. And towards the end, towards an hour in, I was just stretching, thinking that was going to help. And I'm stretching the last 30 minutes to see if I can find any relief. And occasionally I leave early.
Is it for the heel?
Mm-hmm.
So you want to be really careful about that. If you're playing any kind of jumping or running sport and it starts feeling like it's drawing up, you can stretch that out a little bit, but if you keep pushing through that, you can actually create a larger tear or even a rupture. I don't say that to scare you, but
no, I know. Yeah. Well, the last time I could feel it getting tight is the best word. And, and so I just stopped. And because I had an injury when I saw you last, which was a while ago. And that's when it started. So it was kind of partially from compensating from a different injury, but then you've got all these other things that kind of build on it. So what I might do is call you after and see how to set up a consultation online. If you guys do that, I'm not there. I do have a PT that I went to for
you're breaking up just a little bit. What did you say?
If you guys do the online consultation, if I'm not physically close by.
You're in Tennessee, we're allowed to. It's a little tricky when it's across state lines. That's the only thing we gotta be careful about. But yeah, that's fine. Are you doing anything here in like 5 minutes? Okay, well, I tell you what, I'm going to close this out, and then I'll get right back on the same link. And then if you want to go walk Riley, I'm going to get a quick drink of water, and then we'll take a look at it.
Okay, so do I just use the same link to get back in?
Yes, same thing to get back in. Jason won't be in the next one. And then if you'll be barefoot and wear some something so I can see your knees down. So either some pants you can roll up or some shorts. Oh, that looks really good. I think he's enticing me with dinner.
Do you want to have dinner and do this at a different time?
No, I'm over at the clinic right now. Oh, that's just wrong. And look at Bailey over there. Like, okay. Jason, I will see you in like 30, 45 minutes. And Jennifer, I'll see you in like 5 or 10. Okay. Bye.
Bye. Let's see. Nope, that didn't work. How do I get out?
There we go.